Sciences, Gauri Bhomik, Madam Shabnam, who has come for today's function, the representative of SBI Foundation, and our director, Women and Child, Dipali Naik, Deputy Director, Jyoti Desai, our Deputy Director Health, Dr. Rupa, our main doctor who has been behind this whole and helped us take this initiative forward, Dr. Anupama Borkar, Dr. Rajendra Desai, and all the members of UE Life Sciences and other institutions that have helped us take this initiative forward, and the doctors and nurses who have been felicitated today, and also our other doctors who have been present here for today's function. Actually, doctors and nurses who have played an important role in seeing that maximum number of scans have been done, and I'm really very happy that this started over a conversation. But today, in the state of Goa, we are trying our best to see what we can do and how we can move forward. And actually, this was a very important initiative for us, because as far as breast cancer goes, we were just talking, and we've been talking over the last so many years about how do we bring this under control, what do we need to do, and how do we move forward. Goa being a very small state, I would like to share with all the dignitaries on the dais is that we have also moved a long way from the time when we started and thinking of doing things in terms of preventive medicine and several other initiatives that the state needs to take. In those days, we used to spend a lot of money, we still spend a lot of money on once illness is detected. And cancer is something that all of us know that has its own tremendous amount of, it drains virtually the families, that when an individual in their family gets cancer. That's how Dr. Anupama Borkar started this set up in Goa Medical College. And with the Dean was also mentioning that we are now getting another vehicle that will be used basically for scanning and other, not scanning, basically used in, that will be strategically used in trying to see that people then don't need to come to the main center in case mammography and other things are done. But things have changed, and our whole objective, the reason of having all the doctors and having our director, deputy director, WCD also, is to integrate the activities of the women and child department along with the health. Then we are in a better position to spread information and better position to also collect information from the field. Today, last couple of days back, the Honorable Prime Minister was also here. He also spoke about taking initiatives on preventive medicine and how do we take these initiatives. And that's when I got an opportunity to exchange few thoughts as to what Goa as a state is doing. Today, getting cancer, Shabnamji just mentioned, when Nuraji was detected with cancer, is sometimes it leaves the family clueless. And as in the rural areas, though we are a very literate state, in the rural areas when people get cancer, they definitely don't know till it is, till it is stage, it starts creating problems from them, maybe it is stage 2, or they are not able to actually understand what is happening with their body. As a result, what we are doing is we are carrying out satellite OPDs, we are trying to see that we are able to push, I am grateful to the doctors, the team of the health services and the Goa Medical College. Dr. Jude is also here, but our doctors are doing a phenomenal job. They support every initiative that we take. They support every cause that we are passionate about. And also the nurses are extremely good as far as Goa is concerned. Our nurses that we have in the medical setup, they are really doing a good job. And the doctors also are doing a good job. We are now trying to integrate and have convergence of various OPDs and trying to see how we can move forward. But ultimately, what is it that we want to achieve? We want to achieve something where we are able to, when we talk about cancer, is try to see that we are able to actually save somebody's life before the cancer as a disease moves or progresses further. So for that identification, camps, creating awareness among women, which we are doing in our state, and being a small state, for us it is easy to implement certain things, carrying out these pap smear tests, several other tests when we have these health camps. We have this year, we are yet to start with a couple of health camps in various locations. But it is very important for us. Outreach is something that we are going to stress on and we are stressing on. And like I mentioned to you, is that I told you on the phone, is that we need to touch this 2 lakh figure. How we touch it, that you leave to us. We will touch it because we need to see that every woman in the state of Goa, breast cancer is one of the diseases that is already on the rise, and it's one of the highest, I think, if you compare it to different parts of the country. When we talk, we actually say lifestyle. Lifestyle becomes the easiest thing to make a mention as to this is the reason why this is happening. So we thought that we should stress, and we are also now in the work, our work is actually going on for putting up a new State Institute of Cancer along with Tata Memorial. We are in the process. We have decided on the instructions of the Prime Minister is that we will be tying up with Tata Memorial and Government of India and Government of Goa to have a state-of-art facility for cancer so that people of Goa don't have to move out. But that comes as, like Doctor mentioned to you about the linear accelerators, having a focused approach in terms of giving medicine. So there also, same person, doctor recommended, Mr. Kailash Sharma, he is also been recommended by Government of India to come and oversee, and that we had already moved long time back. So ultimately, there are several new initiatives. People have come forward in the last, there has been so much of drastic change in the thought process of medicine in the last couple of years. During COVID also, Goa did very well in terms of saving lives of the people, and also in preventive medicine, because preventive medicine definitely helps in saving future costs, not only to that family, but also from the state point of view. Then that money what you save, you can reinvest it into something else in order to save lives of people. We are at a stage, and we are working, all our doctors thought that since I have now got additional responsibilities that I am not paying much attention to health. That is not the case. Case is that there are several people coming with several proposals. We are now coming with diagnostics. We are taking diagnostics to the PHC and CHC level. Our file has just been approved. We are tying up with one of the Government of India organizations so that we are able to create a hub and spoke model, so that we are able to again stress on how we are able to, we can provide the best of healthcare, best of diagnostics at the rural level, and this is what will help us move forward. Earlier we started a program on thrombolizing of patients, understanding that was the cardiac part of it. Then doctor mentioned the other day that even in case of stroke patients that we are making headway, we need to move forward. But then cancer is something that we want to concentrate on. A lot of people, as we speak, I have a couple of friends who have been detected with, I don't know why, but pancreatic cancer also is again now coming up in the state of Goa. Now why and what, and nobody has an answer to that particular thing. So as a result, how do we save the lives of people? How do we create awareness? And for that, the nurses, doctors, we need to train them in such a manner that even they at their level, basic things like identification, where a person has to be referred to some other place, I think that is very important. And for that, we need to move forward in a very different manner and a very different approach. And I am really grateful to the whole team of DHS and Goa Medical College for all the doctors for always supporting us in what we are doing. New initiatives, new things, using of technology in a new way in order to save people's lives is what the state of Goa has been looking at. Also, we are trying to see having a focused approach, with the help of Department of Women and Child, which has been very proactive, because that is one department that's got first-hand information and is able to give us a feel in terms of what's happening overall. And with the DHS and integration of these two departments, I think we will be able to make a lot of headway on various aspects, right? From reducing infant mortality, right to managing women's health, women's well-being, and now also the Government of India has given us a lot of money in terms of urban wellness centers. So that concept has to be we have to define it in such a way so that we are able to optimum utilize these particular things and these particular infrastructure and initiatives that they are taking forward. So I'm very happy today that on today's occasion, today's day we are having this function, and also that we have completed more than 50,000 scans, which is it's a challenge by itself. Initially, nobody believed in what we want to do, and nobody believed what we want to say or what we want to do. This is over a cup of coffee when we met. I met me over a cup of coffee, and I called him up because there's an article in New York Times. So basically, we thought that we need to do something in taking this initiative forward. Hurdles come, but I think now, with the vision of the Honorable Prime Minister, a lot of things are opening up. And a lot of things are opening up, as a result of which there's a future for different streams of doctors also. There's a future for medicine and also for having an opportunity to save people's lives. And that is coming through the conversation that we have. And when you have a conversation, then you know. And now we are working, like you mentioned, the Joint Secretary Government of India, he is going to come here. And we have made it, I have mentioned the other day to the Honorable Prime Minister, is that we are going to showcase where everybody will say that it is a Goa model that needs to be taken forward. It is not the Delhi model that has to be taken forward, but it is our model that needs to be taken forward. Because every television that you see, but nobody sees, everybody is like, only on those mohalla clinics and all, which is actually nothing other than what we offer here. Our sub-health centers, our rural medical dispensaries, our doctors do a far superior job, and that effect we saw during COVID. And as a result, we need to see how to move forward. We have got a lot of money that is coming in from Government of India. We want to actually take this as a challenge, try to see that we create more opportunities for doctors to come into the mainstream and move forward. Actually, just few days back, people were saying that the profiling of people is changing. People are coming in a big way to, invest in the state of Goa. Somebody from Apollo mentioned to me the other day that they want to set up a hospital in our state. Somebody mentioned they want to have assisted living. Somebody mentioned they want to have various rehab centers, and several things and several initiatives where people keep talking in conversation. But now it's not only a conversation, people want to take it to its logical, and which will definitely help our people. I am only suggesting to all our doctors who are present here that we need to only be passionate about what we do. There are several new initiatives will come, several trainings which will come, but your initiative, your role, I know what role you play. Nobody has to tell me, because this is my 11th year as a health minister of the state. With God's grace, I have been continuing, and I have been seeing these programs through, and it has been a great, for me also it's a great matter of pride that our doctors do such a phenomenal job. And all our Deputy Director, Dr. Rupa, all of them, I think we have worked now so many years together, so everybody knows each other's temperament. All of us know what it is, so that is most important. It is very important, like I know exactly like what is to be said, what is to be done, but our doctors do a good job. This side, we have Department of Women and Child, Deepali Naik is there, Jyoti Desai is there. So I only talk what is required nowadays. So they always find it very difficult to believe why I don't communicate. I don't communicate because I communicate wherever it is required. Only because I think it is better they evolve in a different way and move forward. And I think it's very important for all the young doctors to pick up these new initiatives that are there. We will be bringing a series of new initiatives in these next 2-3 months. People who have come forward to us and offered new ways of moving forward. We need to do that. But today we are here to celebrate and to congratulate Life Sciences and also their partners, the SBI Foundation, Indian Institute of Banking, Madam Shabnam, and our team of doctors who has been a part of this whole initiative for completing these scans. And like I said, now I am confident, and I can say that there won't be any issue in terms of funding, any kind of initiative or funding in terms of taking things forward, because we want to complete and we want to keep such programs on so that we are able to identify the women, pick them up, send them for the mammogram. Actually, we had many years back started an initiative for, and I think we had, when Dr. Rajendra was the director, We had two state-of-art buses where we used to take them to the health center or urban health center. Earlier they used to do the scanning, screening, but now today with your initiative and your technology and these vehicles which will be brought, we can at least have a very planned and structured program so people don't have to come to the main Goa Medical College. I think Dr. Anupam Aborkar can then accordingly structure that program and we can take it forward. All our doctors who are present here today, I am really grateful to all of you for being a part of these initiatives. Health department today is a department that is a very vibrant department. Whether it is DHS, whether it is Goa Medical College, I think people are really very happy and people talk about taking treatment in a government institution, which is a reverse in other states. People avoid taking treatment in government institutions, but here people come to take treatment in government institutions, including my father when he was not well. We had our doctors who played a very important role in giving him treatment. But this is how Goa is functioning and Goa is moving forward. And for that, let me tell you, nurses, again I am stressing, all our staff, they have become really very passionate about their job, and I think that is something to be appreciated, and I am really grateful to them because I work with them very closely. I observe a lot these days, what is happening, what is not happening. There are issues, we fight those issues, but we will take this program ahead and we will ensure that we touch those scans. For that we require your support, and we will see that whatever the funding, whatever is required, is also, we are in the process of also strengthening our sub-health centers and rural medical dispensaries, because that is where it has to be strong, right from blood diagnostics to other things have to be made available there so that we are able to do several things. It's you, me, people sitting on the dais who know that every quarter, if you are on certain medication, that you do a test, you do your blood profile on a regular basis. But the poor man doesn't know what he has to do. He has to be told that this is to be done. He has to be asked that you have to do your blood profile of, if you find there are certain symptoms that you need to see that he is taken care of. Very few people can afford cancer markers and other things, but there in our Goa Medical College we do free of charge. But this is how we need to move forward. This has to become a unique state, and with your support and initiative, I think Swasth Mahila, Swasth Goa will become a reality. Other states I don't know, but in our state we are very passionate about every initiative that we take forward. And like I said, I mentioned in presence of the Honorable Prime Minister is like the model that the concerned people talk about in Delhi, about the Delhi model which is there, and people harp about it, because that is nowhere close to what we are actually doing on the ground and how we are treating the people. And I wanted him to know that it is his state which is here, which runs the government in the state of Goa, that we are able to take this initiative forward in spite of being educated, in spite of being in spite of having all the knowledge that we have. Many times we miss certain things, then it goes into a different tangent, any illness. As a result, we need to catch it properly and see that we are able to identify and able to tell the person what is the situation and accordingly take it forward. I would like to thank all of you, and I am really actually looking forward for this new hospital of us to get ready at the earliest. Hopefully it will get ready at the earliest, but now with Government of India intervention and with Tata Memorial intervention, I was just told a few days back that the officer, Mr. Vishal Chavan, will come here, and along with Dr. Kailash Sharma, and we will take a series of meetings to see that as per what they want, we are able to put a state-of-art facility in this place, and this will further strengthen our outreach programs and our preventive measures that we want to take. Having a facility is also very important, and I think we will be able to move forward. Once again, wishing the whole team of UV Life Sciences, our Director Health Services, and the whole team, Deputy Director Rupa, our Dean, Dr. Bandekar, Director WCD, Deputy Director WCD, Dr. Jyoti Desai, everyone else, Gauri and Gauri, everyone else is present on the dais. I would like to thank all of you, and Yuvraj Singh Foundation especially. At a time when we wanted support, various other organizations came together to help us to take this initiative forward, and we will support this initiative and we will make it a success. We want Goa to be safe, we want women to be safe, healthcare of women, and also what I suggested to the Dean is to have a total executive checkup of all the nurses on an annual basis, all the doctors on an annual basis. It's a must. The state must spend on its professionals in a very, we go and do it ourselves, and it has to be done every year. You never know how the body changes, it's what happens inside the body. So as a result, this thing has to be structured, and I think on this day we should make a commitment to all the nurses, doctors from DHS also. You have to identify whether it's going to be North Goa, it's going to be South Goa, or it's going to be GMC alone that will carry out this, because we got large number of staff. So we need to have a total full from the nurses point, from whether it is nurses, whether it is doctors. We need to have this executive checkup initiated at the earliest, so that we can do it in one center, so that we must do it on an annual basis. So this is something that is least the state can do for the doctors and for our staff that is contributing and taking our passion, our initiatives forward. I would like to thank all of you for coming here today, and I'm sure we'll achieve our goals and objectives as we had planned, as we had discussed. And thank you so much for coming here today. Thank you.